Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine, and I wanted to talk to you today about one of the main sources of joint pain that I see that is typically going underdiagnosed or not diagnosed at all. And every time a patient comes in to see me for the first time for a joint complaint or a pain complaint, which is most often why people come in to see me, just because I'm practicing platelet-rich plasma and prolotherapy injections. And so a patient may come in and say, hey, I have knee pain on both sides and a shoulder, and shoulder pain as well. And as soon as joints start to hurt all over the body, or I'm seeing people complaining of multiple areas of joint pain without like a real specific reason for the pain to be in that area, then I'm kind of, my little red flags are going up saying there's something else going on here. And it doesn't necessarily mean that the pain in the joint will entirely go away once the underlying conditions are treated, but typically they are at least 50% less than if that were to go untreated. And anytime that I inject platelet-rich plasma or prolotherapy into a joint, I want to know that I'm actually, healing the pain generator, the true cause of pain. And so for me, it's really important to make sure that there are not other causes of pain that are not an injectable source. And so one of the main causes of pain that I see is hypothyroidism. And hypothyroidism is a pretty, honestly, if you don't join the club, if you have it, it's kind of like, I don't really know too many people that either haven't had hypothyroidism at some point in their life or probably will have it at some point in their life. And there's multitudes of reasons for that. Primarily, just the American lifestyle and society is one of the main reasons. Chronic stress and, being overworked and that sort of thing can cause hypothyroidism. So it's not shocking that many people have this. And the range for hypothyroidism on a lab test is actually quite wide, and typical conventional medicine only tests thyroid stimulating hormone, TSH, and that's really not enough. It's actually not a thyroid hormone. It's released by a gland up in your brain that tells the thyroid, hey, you need to make more T4 or more T3, or you need to make less T4 and less T3. T4 and T3 are actual thyroid hormones. Your thyroid is right here, and T4 converts to T3 and then to free T3, and I'm oversimplifying that, but just for sake of simplicity, we'll just stop there, because the thyroid conversion between T4 and T3 can get very complex, and it uses a lot of micronutrients also. And so when conventional medicine just tests TSH, they're not actually testing real function of the thyroid. They're just testing the signal on whether or not the thyroid is working, right? And so often I see this all the time, once that the TSH is totally normal, maybe not optimal, but normal. Maybe it is even optimal, meaning my range is smaller for optimal. I'm looking for optimal levels, not normal levels when I look at these lab tests. And so what can happen is the TSH can be optimal or normal, and then I see that the T3 and T4 are low. And I have helped hundreds of people with many different types of pain complaints because of this type of lab testing. And so if you have joint pain all over your body, and maybe not even necessarily muscular pain, but you're just kind of like, man, my joints ache, or they ache while I'm sleeping, or I can't get comfortable in bed, and it's more than one joint, and it's, there isn't an injury in that joint, it's really time to get a full thyroid panel done first and foremost, because just treating that alone could make a huge difference in decreasing pain in your overall body. It also improves metabolism, sleep, it increases immune function, which is so important right now. And so you really don't want to be walking around with a subclinical hypothyroid. And by subclinical, I mean it's not fully out of the range. The TSH isn't fully out of the range yet. There are ways to optimize thyroid function, way before that gets out of the range. By the time it's out of the range, like, you've had that for a long time, and things are really gone downhill for you. And it can be really minuscule. Sometimes you can chalk these symptoms of hypothyroidism up to just kind of anything, like, oh, whatever I ate that day, or the symptoms can kind of come and go. So brittle nails, hair falling out, constipation, a lot of these things can just be like, well, I've always been this way, or, it comes and goes with the seasons, or I think it has to do with something I eat. And so the thyroid really functions on a lot of different planes and a lot of different systems of the body, which can make it difficult for a layperson to know that that's what's happening also. So I just kind of wanted to really bring some awareness to that because it's a really important component of treating pain in my practice. And the main causes of hypothyroidism are either an autoimmune condition related to the thyroid, and so the body is making antibodies that are, attacking the thyroid and making it function not as well as it should, and that can be happening when all the levels are even optimal or normal. So it's important to get antibodies tested when you're looking through, this workup with someone. And I'm not testing this on every single person, but most of the time I am, and especially if there's multiple joints that are hurting, because I want to make sure that person's going to get a really good result from platelet-rich plasma and prolotherapy, or one or the other if we're doing either. So the other causes of hypothyroidism are chronic stress, so adrenal fatigue. When there is high cortisol levels or, dramatically shifting cortisol levels throughout the body for years on end, that's the foundation of your hormonal house. Your adrenal glands sit on top of your kidneys, and they make stress hormone. They make some sex hormones as well. And so it's really important that those are functioning well and that you're managing stress well, because if you have prolonged stress in your life and it's not being managed well, then you can get adrenal fatigue, and over years that can cause hypothyroidism because the signals and the concentration of hormones in your body are not correct. So hormone means messenger, and the hormone function in a way, all hormones function in a way of concentration. And so if your body has, like, let's say 5 liters of blood, and there's, for simplicity's sake, 1 liter of cortisol, and that's normal, high stress, 2 liters of cortisol, then, which is, way blown up. It's not that much, but it's just to give you an idea of how it works. So 2 liters of cortisol now, dramatically more, is then going to affect the thyroid and the blood sugar and lots of other things. And repetitive increases in that is eventually going to cause not necessarily permanent change, but lab tested change, like change that you can see on labs in the thyroid. So autoimmune condition, chronic stress over long periods of time, and then lastly is anemia. So when there's B12, folic acid, or iron deficiency anemia going on, that is also often underdiagnosed in conventional medicine because especially with iron deficiency anemia, there's a lab test called ferritin. It's typically stored iron. It can mean one other thing. We're not going to get into that today. But when it is actually meaning stored iron, the normal levels are from 12 to 150, at least with my lab, or 15 to 150. It can be 12 or 15 depending on the lab. And so if that level, if your stored iron or ferritin level is below a 50, you are starting to feel the effects of iron deficiency anemia way before they are ever seen as abnormal on a lab test. And so when your ferritin levels start to get lower and lower, then you're going to start to have some symptoms of iron deficiency anemia. And then, fatigue and palpitations, trouble sleeping, heavy menstrual cycles, too light menstrual cycles, abnormal menstrual cycles, lots of different things can mean that. So I'm looking at that too. And so anytime someone has hypothyroidism, I'm like, why is this happening? Is it chronic stress? Is it anemia? Is it an autoimmune problem? Because I need to fix that with that person before I can inject them with platelet-rich plasma or prolotherapy, because if that is not addressed first and foremost, then the prolotherapy and the PRP is not going to work. And if it does work, it's not going to work long term. And if it does work, it's just going to be a minor amount compared to what it could. So, for example, if I don't address those issues in that person's body, they might get 10% of improvement when they could have gotten 50 or 70% from one injection. And because these services are out-of-pocket services, I don't want to have to continue to inject a joint that is not responding because of something systemic going on in that patient's body. And so I really, really think that this is really widely just not people are not aware of it. Other conventional medical doctors are not aware of this. Really don't go ask your MD or your primary care doctor about this, because they are not going to know about it. They are not trained in it this way. It's not their fault. It's just how they are trained in their medical school versus how a naturopathic doctor is trained. So if you feel like you have a thyroid issue, or you're not sure, but you really want to get to the bottom of it, and you really want to find out if that is causing some other things that are going on in your body, or if that's causing some of your joint pain, even osteoarthritis, guys. Like you could be like a 55-year-old male or female with, knee pain on both sides or knee pain and shoulder pain, and go to your MD. Your levels look normal, and they're like, oh yeah, that's osteoarthritis. That's just normal. You're getting old. Okay, thanks, bye, and like nothing more about it, right? Like eventually you're going to need a joint replacement. That's just how it goes. Don't be a victim to that. Don't allow that to be the end of the road for you. There are strategies, there are solutions. There's a really good chance something's getting missed, and it's very likely that it's hypothyroidism, and it's treatable, and it can improve your quality of life dramatically. I mean, really, really dramatically. So if you are concerned about hypothyroidism, and you're wondering if maybe some of your pain is being caused by that, then you need to go see a naturopathic doctor that knows how to treat it, because not all naturopathic doctors specialize in hypothyroidism. So you want to make sure that you go to somebody who knows what they're doing. There are lots of different ways to treat it depending on what the situation is. And so you really just want to make sure. I mean, it's a pretty simple question. Do you specialize in hypothyroidism? Or thyroid disorders, because hyperthyroidism can happen too, and you want someone who specializes in both if they're going to specialize in that issue. So that's all for today. I just really wanted to bring some awareness to that, especially as we come into winter and joints start aching. It's time to figure out why. So if you would like an appointment, our phone number is 206-899-6000. If you know anyone that could use this video, please share, like, and subscribe down below. That would be excellent. And you can follow me at Instagram at Dr. Amber Nixon.